I'll just say that having the experience to serve on the Finance and Appropriations Committee this year, it was an eye-opening experience. As Tracy mentioned, Governor Kasich has in fact done what he said he would do when he ran for election, and we did not do what we were supposed to do when he ran for election, and that was to come out and vote based on the information that you had before you, and vote for the best person who had your interests in mind. That would have been Ted Strickland. We have an $8 billion budget deficit, but in this budget, the Republican majority has not only found that $8 million, but they have in fact increased the budget by $5 billion. So we're asking, how did that happen? Well, once again, as Tracy, Representative Hurd mentioned, they in fact are giving a lot of credit and a lot of support to their friends. They have just shifted the numbers, shifted the burden of this budget on the backs of those who we support, those who we represent, the minority community, seniors, children, the middle class. But I would go even further to say that this also affects the poor class. Many of us live check to check. Many of our neighborhoods that are going to be impacted the most are of poor communities. If I go further into some of the things that were done, I sat on the Subcommittee of Health and Human Services, and the big issue there was Medicaid. And one of the big aspects of Medicaid was Passport that supports our seniors. Also, nursing homes. They feel that nursing homes are the enemy here, and so they made major cuts to the nursing home community, because what they're attempting to do is what they call home health care, in which really they want to allow seniors to stay in their homes opposed to being in the nursing home or in another environment that is costly. But the fact of the matter is that in order for that to occur, they had to find dollars elsewhere. So you see major cuts across the board as it relates to health care. You saw major cuts as it related to supporting our children, specifically in child care, specifically as it relates to making sure that our children are safe, protective services. We saw a number of cuts being made as it related to minority health. Decisions such as cutting dollars to the YMCAs across the state that dealt with diabetes. As you well know, in our community, diabetes is disproportionately impacting our community. And so you saw cuts there. Representative Hurd mentioned about selling off our assets. So currently we have 5 prisons up for sale within the Department of Rehab and Corrections.